Okay, good.
Assalamu alaikum, and thank you all for joining in today's very important and pertinent webinar. Today, we will be talking with Dr. Mobeen Rathore, who is an infectious disease specialist in Jacksonville, Florida, in regarding the Omicron variant. On November 24th, 2021, a new variant of SARS was reported to the World Health Organization. This new variant was first detected in specimens collected on November 11th, 2021 in Botswana, and on November 14th, 2021 in South Africa. On November 26, 2021, WHO named the B11529 Omicron and classified it as a variant of concern. On November 30th, the United States designated Omicron as a variant of concern. And on December 1st, 2021, the first confirmed US case of Omicron was identified. CDC has been collaborating with global public health and industry partners to learn more about Omicron. As we continue to monitor the course, CDC has been using genomic surveillance throughout the course of the pandemic to track variants of SARS-CoV-2, the virus that causes COVID-19, and inform public health practice. We don't yet know how easily it spreads, the severity of illness it causes, or how well available vaccines and medicines work against it. So to talk with us more about the Omicron variant, we would like to welcome Dr. Mobeen Rathore again. So before we start our discussion and Dr. Rathore tells us more about it, I would like to say a little bit and talk a little bit about Dr. Rathore. Dr. Mobeen Rathore is Chief of Infectious Diseases for UF Health Jacksonville and Wolfson Children's Hospital and Professor and Associate Chair for the UF College of Medicine, Jacksonville. He is the founding director of UF Center for HIV/AIDS Research, Education, and Service. Dr. Rathore has served on the board of Wolfson Children's Hospital and UF Jacksonville Practice Plan. Dr. Rathore is an infectious disease specialist in Jacksonville, Florida, and has been practicing for 29 years. He graduated from King Edward Medical College and specializes in infectious disease medicine. Dr. Mobeen Rathore specializes in pediatric infectious diseases and cares for children throughout the diagnosis, treatment, and prevention of infectious diseases. Dr. Rathore has not only closed the town and gown gap in medicine, but he is also very active in the community, serving on the boards of OneJax, our diversity, inclusion, advocacy organization, and environmental protection board. He is president of the board of Mass Free Clinic for the uninsured and president-elect of Leadership Jacksonville. A fervent advocate for all children and especially children with HIV, he has been instrumental in the improvement of HIV care of children and pregnant women in the state of Florida. Dr. Mobeen Rathore, thank you very much for taking time out of your busy schedule and joining us today. The floor is yours.
Thank you so much. Assalamu alaikum, everybody. And thank you for that kind introduction. You know, I started my career as a vaccinologist at Washington University in St. Louis. And then I came to Jacksonville, and we were in the early parts of a pandemic of HIV. And so I changed my career and became a HIV specialist and developed programs there. And it's interesting that many of the lessons that I learned and all of us learned in the HIV pandemic are also very applicable to what we are learning in the coronavirus pandemic. And it looks like it's been going on forever, but we forget that it's only 2 years old. The first time we heard about this was in December of, I think it was 2019. Gosh, it seems a long time ago. And so we are still learning. The trajectory of learning about this virus has been terrific. The sort of comparing it to the HIV pandemic, the main success of this pandemic response has been the development of the vaccine, which unfortunately the HIV pandemic they're still in search for the vaccine. The flip side of that is in the HIV, we have lots of good treatments. We now have treatment we can give a shot once a month, and now developing treatment that will be once a year maybe. So unfortunately, we do not have that good of antivirals for coronavirus, although there's one that is Pfizer is going to, it looks pretty good. So I think we came from all the chaos and all the concerns and major stresses of the impending disaster. And, you know, United States has now had almost 800,000, more than 800,000 deaths and many more millions of cases of coronavirus worldwide. Things have even been worse. I think the availability of vaccine made a huge difference, and it can make even more difference, even greater difference if everybody gets the vaccine. So I think the original thing the virus was concerned, by the way, hold on a second, guys. My apologies. I heard a large noise and I want to make sure everything is okay in my house. Apologize for that. But anyways, so I think we have learned a lot how to take care of this virus, but we still have to learn a lot how to take care of this virus. So then, of course, the Delta variant came, which was really, in many ways, even worse than the original wild type virus infection. But I think we did better because we had learned a lot more about how to take care of the infection, and also the elderly. A lot of the elderly had been immunized, because if you're going back originally, a lot of the deaths were actually in the elderly, especially in the state of Florida where I practice. And then the Delta variant sort of fortunately withered away, and now, of course, we are in the Omicron, and so the Omicron is again, a lot more people are immunized, and so that's the good news. Omicron is sort of is an interesting variant, very different than Delta. And it has a potential to impact the United States as it is now doing, as it did in Africa. And but I think the full extent of how it's going to impact the United States still remains to be seen. I don't think we have really knows thus far the exact impact of this. But you know, the CDC and the other agencies are working very closely to look at how to best respond to this variant, and as information becomes available, you know, the recommendations will change. So, as you all know, as Nazi had mentioned, in early November there was an increase of cases that was noted in South Africa, in the Gauteng province in South Africa, and which is really where Johannesburg is located. And at that point in South Africa, you know, the prevalence of the infection was quite low, and then suddenly they sort of saw this notable increase in the infection, which got them very concerned. Interestingly, the initial cluster was among university students who had been on a bus trip together, as many of us have done during our school and college years. When this was in Western Cape area, Cape Town area, and so when they took the samples, they found that 12 of the 16 would have, you know, there were some changes in the genes of the virus. To make a long story short, they identified this variant, and it was the WHO called it Omicron variant. And then this variant since then has been detected all over the world. And in the United States, it's been, except for 8 states, it has been identified almost in every other state. And so I think the important thing to mention about this virus is that viruses, when they replicate, they mutate. Actually, there is this mutation is a sort of a mistake. A mistake happens with replication. For the virus to mutate, they need to replicate. That's why we hear this all the time. If more people are immunized and protected, there's less opportunity for the virus to replicate and less opportunity for the virus to mutate. In the South Africa, the immunization rate is about 35% or so. So that's, so they always do this. The viruses are constantly making mistakes and replicating and mutating. And the viruses or all organisms' whole purpose of their life is to flourish. And if they have a variant which is very deadly, that is actually not in the virus's favor if you think about from virus's perspective. Because if they infect somebody and that person dies, so does the virus. So if you think about it from the virus perspective, that's not a good thing. They need to have a way that they flourish without killing the person, the host. And Omicron does that. Omicron virus is the virus that the variant in which the virus replicates and flourishes, but does not really kill the infected host. Also in South Africa, this was initially seen in the immune compromised because they are the ones who got sicker and came to attention. And the other reason it was perhaps seen in the immune compromised is because the immunity was not as good, so they could not protect themselves by killing the virus. So the virus had a greater opportunity to replicate. I go through all this detail so that we understand this virus is different for our most recent experience with Delta virus. It is more contagious. The R naught, which is sort of a quotient we use for contagiousness, R naught for Delta was 1.47. R naught for Omicron is 1.93. So it's at least 33% more contagious. So it can infect a lot more people than the Delta variant could. But so that's the bad news. The good news, if any, is that it doesn't cause a serious illness, doesn't cause death in the otherwise healthy. Those who have morbidity, underlying health conditions, their risk is still high. So if they can still have serious problems. In South Africa and other parts of the world, even though the infections are quite extensive, the hospitalizations are not. Although in the United States, now I think the hospitalization rate has already increased by about 25%, even though the positivity rate has perhaps not gone as high, but it's still, there are more and more infections being seen. So this virus, so what do you do about it? Well, what you do about in this case particularly is that since it's a more contagious virus, if you can blunt the contagiousness of the virus, that's the answer. Because as you know, the virus is less likely to make you very ill, especially if you are otherwise healthy. Now we know the vaccine is very good and protects, but there is something phenomenon of immune escape where the virus can escape the immunity given to you by the vaccine. And one of the things we now know is that if you are boosted, and right now everybody 18 and older is eligible for a booster, they should get the booster because it increases their protection. We also know that Moderna and Pfizer vaccines are perhaps the best after boosting in terms of protecting against Omicron. So those of us who have got the vaccine, they should get boosted with that. Now, the AstraZeneca, Sputnik, the Russian vaccine, the Chinese vaccine, not as much. And South Africa has AstraZeneca. But keep in mind, of all the countries, United States is really, as a nation, is quite highly immunized right now, not boosted as well. Only about 20-30% of the immunized people are boosted. So when you do that, so the information we learn about immune escape from Pfizer and Moderna is going to come from the United States. We learn more about it, how good, how effective it. All evidence thus far suggests that it is much better protection than it is with the other vaccines, although protection may not be the 93, 95% that we knew previously for other variants. So what can we do to prevent this? Well, get the vaccine. If you haven't gotten, get a booster if you haven't gotten it. But then we also have to do other things, keep on doing other things, I should say. When I say it spreads more easily than compared to Delta, previous ones, and I think the final word has not been said on that. But the way to prevent is to really, after vaccine, is to wear a mask. I think I've given this example before. The way I look at this coronavirus, we can make things safer. Okay, we may not be able to make things absolutely safe, but that's true for anything we do in life. When we get in a car, we drive, we hope that our car's chassis is so strong that it protects it, and then put a seatbelt, and we hope that our car has airbag. So that makes us safer, never 100% safe, but we drive every day. We don't think about it. But think about this. The chassis of your car is your social distancing. So if you can keep people away from you 6 feet at least, you're going to be protected. Look at your seat belt as your mask. You put on your mask, so you're constantly being protected against any virus that's out there in the air, in the environment that you come in contact with. And then look at your airbags is your vaccine. It is there. If you do get exposed to if you get in an accident in a car, the airbags deploy. If you get exposed to the virus in your everyday life, the vaccine, the immunity that you've already built deploys, and then it will protect you against this. So that's how I would think about it. Now, you guys will probably be hearing schools and universities may be shutting down, doing homeschooling and things like that, virtual learning. And one of the reasons for that is that the virus spreads very easily. And so if the immunization rate in your institution is not very high, you could have a real challenge with the infection being spread to many, many, many people. So we do have tools to fight this infection, which is the vaccine. Get your vaccine, get your booster if you've not gotten it. Masks, again, you cannot, I think if you could try to get a medical grade mask, but any facial covering is fine. And the one other thing with this, because people are not going to get as sick, testing becomes very important. And there are really, if you think about it, the tests that are available are several types. So there's the antigen test, that's most of your home tests. They are not as good if they are negative. They are positive, they are good. So their positive predictive value is good, but their negative predictive value is not good. But then there are the molecular tests, which is usually the NAT or the PCR that we hear about. And those are the better tests. Those are the gold standard. So now, we can do that in 30 minutes. We have it in our office. Somebody comes in, wants to get tested, we can test them, and in 25, 30 minutes, we have the results. So many doctors' offices have these machines that they can do that. So I think that's the testing more, and unfortunately, we are not as, we did a great job with immunization, or, although there's still a lot of room for improvement, we are not, as a nation, have done a good job testing, availability of testing, cost of testing. Other parts of Europe and developed parts of the world, testing has been really, even in Pakistan, testing is very easily available, and you get the result next day. Last time I was in Pakistan, it cost about 6,500 rupees, which is a lot of money for Pakistan. But if you think about it, that's not very expensive. So I think that's something testing would be, get home testing if you are concerned. You can test. There are people who say test frequently, and if you're positive, even if you're asymptomatic and you're positive, I think you can still do some additional activities. So I will stop here. There's a lot more I can say, but I think Nazia said there are some questions they have received. I'll try to answer those questions. And if the people who are on the call or on Facebook Live, if they have questions, you can put them in chat. And I think Asif is monitoring that area. So please add your questions in the chat box or on Facebook Live, and we'll be happy to answer them. So Nazir, back to you.
Thank you very much, Mobeen Bhai. So looking at the list of questions, I think you answered most of them, but if you don't mind repeating, I'm just going to ask you again so that, people still get the answers. So the number one question that we got was, why are we concerned about the Omicron variant?
Yeah, I think the main concern about Omicron variant is that it spreads, it's very much more contagious than Delta variant. It spreads very fast. And if you think about it, these numbers are not accurate and exact, so just for a conceptual framework, if Delta could spread to 100 people and Omicron could spread to 1,000 people, and Delta could make 20% of the people ill, so that would be 20 people. If Omicron can make 5% of the people ill among 1,000, that's still 50. So if the denominator is so high, your absolute numbers are going to go up. And so same way downstream, more people are going to who are sicker, more are going to get hospitalized, more are going to get in the ICU, more are going to get intubated, and more are going to die. Now that's so it's we always have to think in context of how much infection is and prevalence is in the community, and as a result, because of that, there's a lot of concern about that. And we also know that in those people who have increased morbidity, who have underlying morbidity, they have a higher risk of morbidity and mortality even with Omicron.
Thank you. Are symptoms associated with Omicron different than the other variants?
No, the virus is the same. So symptoms are not different. They're going to be similar. Now, one thing, perhaps because if there's going to be immune escape from this, that maybe there can be more pulmonary signs and symptoms perhaps than systemic in this virus, but the symptoms are going to be similar. There's some learning going on. Maybe there are more rashes with this. I mean, there are going to be slight differences, but we learn about it. I don't think we know exactly what the whole spectrum of signs and symptoms is, but overall, the signs and symptoms are going to be similar to Delta and the original virus, but it's not going to be as, the severity was not going to be as bad.
Okay, thank you. Are the current COVID-19 tests able to detect Omicron?
Yeah, most of them are. You should check on that because there were a few tests that did not check. I think some of the TACMAN tests could not, but more and more, I think the FDA and the CDC websites have a list of tests that will pick Omicron. So I can tell you all the tests we do in our hospital, in our health system, they pick Omicron, but I can't speak for every test out there. So I would recommend you look at the test you have. You can put that in there, and the CDC and the FDA website would be able to help you to know if that particular test would be, and what is the positive and negative predictive value and accuracy of this test for Omicron.
Okay, thank you. Someone just asked, should you wait on getting a booster until there is one on specific Omicron specific shot? No,
you should not wait to get the booster. You need to increase your immunity by getting a booster. When the Omicron, if the Omicron variant vaccine is going to come, yes, we should take it at that time. We don't know that when it will be. I think this is a hotly debated and robustly investigated work where do you produce a vaccine against every strain? We do that with flu viruses. Every year, the influenza for decades, ever since we had a vaccine, the influenza virus, what we call drifts every year, meaning it changes a little bit every year. And so you have a new vaccine. That's why you have a new vaccine every year. The previous year vaccine is not going to be effective. And every 10 to 40 years, it shifts. There's a major change. That's when we have a pandemic. Remember this, those of us remember the 2009 swine flu. That was a shift. And then, those of us who are old enough remember the 67, 68 Hong Kong flu. I remember getting that and getting quite sick with that. I was quite young, believe it or not, but I remember getting really sick with that. So in 1975, we had the swine flu. So that's when the shift happens. And that, so with, and as I said, all viruses replicate and mutate all the time. So I think the question right now is, and for corona SARS-CoV-2, this seems to be much faster that's happening. But fortunately, we have the mRNA platform that we can respond much quicker to develop those vaccines. So I think what we may have to do is just like as we do with flu vaccine, we have to predict which the next mutation is going to be, and then try to see if we can do that. Now, the other thing is, another thing to remember is that even with the flu vaccine, we often have a mismatch. What that means is that the vaccine that was thought to the flu virus strain that was thought to be would be the predominant, was expected to or guessed to be the predominant strain in the flu season. Remember, the flu vaccines are started to build back in February, March for a season that often starts in October, and so there's often a mismatch. But even the mismatched vaccine has some protection against serious illness. So even though they be mismatched, you still give the vaccine. Now, the advantage of again going back to H1N1 outbreak in 2009, what we used was the standard old platform where the vaccine had to be made from eggs. So you had to get the eggs, all those things had to be done. So it took a few months. With messenger mRNA, you can do that much faster. So you can probably produce the vaccine. The question is, how often do you do that? I mean, if there's going to be a new strain, let's say, based on this recent experience, could be every 4 to 6 months, right? Do we get a vaccine every 4 to 6 months? I don't think that's very feasible, but we know that giving the vaccine a booster, first of all, getting the vaccine and then taking the booster helps in protection against Omicron and even Delta. Okay, there's a question in the chat box. I'll take that, Nazia, before you ask the next question. What's the rate of breakthrough infection in South Africa with regards to Omicron virus? We really don't know that as well. That information will be gathered, but don't forget the immunization rate in South Africa is about 35%. So it's not a very highly immunized population. So it's going to be hard to there. And of course, with the almost 10% prevalence of HIV, they may have a totally different population to deal with.
Okay, thank you. What should you do differently to protect yourself against Omicron?
Nothing different. I think I went into quite a bit of detail. Get your vaccine, wear your masks, social distancing, good hand hygiene. Don't try to avoid crowded places. If you have to go to vacation, we need to get as much normality in our life as we can. Go to a nature vacation, go to a national park or a state park outside. Try to avoid crowded congregations, places, movie theaters or other places that you are indoor or with large crowd. If you have to travel, you can travel by air, but preferably you travel by your own car if you can. So you take a vacation within 4 or 5 hours wherever you live. And one of the things I've learned, all my time, almost 40 years in the United States, never went to places in the United States. So we can always do that later. We always, obviously want to go to Pakistan with the kids, but also take vacations in other parts of the world. And so this is a great opportunity for us to take vacations within the United States. Within, there are tons of nice places within 5-hour drive. So do that. I think those are the sorts of things you can, of course, get the vaccine, get the booster. I think that's probably all you can do at this time, but try to get as much normal life as possible.
I think there's another question on the chat. Mobeen, do you want to read it?
How effective are the boosters at fighting Omicron? What we believe that they are the most effective of what we have right now, that information will come. Remember that it also depends on the vaccine. So that we will know that information very soon. But I can tell you what the available information suggests. It is the most effective way of preventing Omicron infection right now we have. So the effectiveness in data, it's not as good as 93, 95% that we knew. But even if it is 60, I mean, let me tell you, if I told you you had a 65% chance of making money on a stock in the market, I think most of us will buy that. So if nothing else, think in those terms.
Excellent. I've just returned from an overseas trip. Is there anything I should do in particular?
Yeah, I mean, depending on where you return from overseas, I think if you return from a part, let's say South Africa or UK, where there's high prevalence, I think I would assume you got tested before you left, but you can again test, because remember the incubation period is about 6 days. It could be as many as 14 days. So you can certainly, if you're symptomatic stuff, certainly start seeing symptoms, see your doctor, get a better test. But you can get the other tests, which are antigen-based tests, do it yourself. So testing would be the thing I would say that you do for after your return if you're concerned.
Okay, thank you very much. Well, that was all the questions that we had. You answered most of the stuff. Any other questions on the chat?
I don't see anything. So I get this question all the time. Right now, a lot of people this year are traveling to Pakistan. It's the holiday time. People educate them, should they go? Should they not go? I understand that maybe some people from Pakistan on the call, they can probably talk about it better. Here's what I tell people. Go if you have to. If you can postpone, great, but don't postpone just. We have to get back to normal. Now, I have family in Pakistan, and it appears that it's not a huge problem in Pakistan right now, or we don't know. So I think if you're going to travel to Pakistan in your flight, it's a long flight, or travel other places, wear your mask, face shield would be good, try to have good hand hygiene, and then when you get there, make sure that you stay, away from crowded areas if you can. Of course, a huge challenge because this is also a lot of time for weddings in Pakistan, so there are going to be a lot of crowded areas. Do the best you can. I think wear the mask there, even if you can. If you can get an N95 mask, I would do that. I went to Pakistan. And believe it or not, and I've been there since then, but in February 25th of 2019, before everything, was a major problem. So I actually took some N95 masks. They were easily available, and I wore them on the plane, at the airport. Even in Pakistan, I wore them. And I can tell you, I used to get looks, and because at that time, a lot of people were not wearing masks. So if you can invest in N95 masks, I would recommend you do that. And then take some hand sanitizer, use as much as possible, and make sure you're vaccinated and boosted, of course, including your children. Now, children as young as 5 years of age can get the vaccine, so make sure that happens. I think let's see. There's another question: is monoclonal antibody treatment effective in case of hospitalizing with a new variant? So, if I remember correctly, and I should have looked this up, but apologize for that. The monoclonal antibodies, I don't believe are approved for inpatient use. I can quickly check that, but they are certainly good for prevention, outpatient treatment. How good they are against Omicron, we'll find out on that. I know outpatient basis, you're using that, but I don't believe it's for inpatient. So let's see. There's another question: if someone recovered from COVID, can she get reinfected with the new variant? Yes, you can. The thing about the natural infection is that you have some protection for probably about 90 days, and you can get infected afterward with variant and other types of. So breakthrough infections can still occur. Though, this leads me to the other question: if you have a natural infection, in the past, CDC was saying you can defer the vaccine up to 90 days. And in large part that was because you were protected for 90 days and the vaccine was not available for everybody. We wanted as many people to be protected as we can. Now the vaccine is easily available. So after your acute illness, you can still get vaccinated and you'll be fine. In fact, it is recommended you are vaccinated and you'll have a much better boost actually from that immune response. The other thing that we often get is that, for the vaccine to be effective, we know after the dose, you take at least 2 to 3 weeks for fuller protection. After the first dose, you're protected until you get the second dose. And after the second dose, 2 weeks after that, you're considered fully protected. Now, it's possible that you could be incubating the virus. So if you had the infection actually on December 13th and you got vaccinated on December 14th, you will probably get the infection. There's no harm in getting the vaccine because obviously you did not know. But if you knew you were infected and you were sick, you would not want to get the vaccine. Just like any other vaccine, you would want to defer the vaccine until your acute illness is totally resolved. Let's see what Omicron means for COVID-19 restrictions. I think what it basically means, different from the other variants, it's much more contagious. If you were not there early on, I had mentioned that Omicron is, the R naught for Omicron is about 2, and R naught for Delta was 1.5, meaning that Omicron is at least 1/3 more contagious, if not more. That means it's much more likely to spread to many more people than Delta. So more careful in trying to prevention of transmission. Hence, the masks become very critical in that. There's another question. I have an African-American friend who's hesitant to take any vaccines and boosters due to general mistrust or distrust of medicine within the African-American community as well as other minority communities. What would you tell these people to convince them in regards to the seriousness of the virus and its variants? Now, this is very unfortunate that we have so much misinformation about this vaccine, and I'm fully cognizant of the mistrust between the minority, especially the African American, and the health system, and that's based on deep-rooted discrimination in our American history. And so I think we need to be cognizant of that. And we work well, and I know because I've been taking care of HIV infected populations for more than 30 years, and unfortunately in Jacksonville, most of them are minority populations, often African American. So we have to develop that relationship, that trust. I think your primary care physician, I think we need to direct them to the right sources and just work with them. I think the African American community, because of the other health inequities and barriers to care, also have higher morbidity in certain things like diabetes, high blood pressure, obesity, and such. And so they are even at higher risk because of that. They're not because of higher risk of infection than anybody else, but because of their comorbidities, they have a higher risk of serious infection. So I think the inequities in healthcare existed in the United States before the pandemic. The pandemic just brought it out to even everybody's attention, and it raised its ugly head in worse ways. So I think we have to regain their trust. I think one person at a time, one community at a time. I work locally with a group of African American healthcare providers, and we try very hard to get our friends and neighbors get vaccinated. But don't forget, it's not only the minority communities. If you look at the map, it's also unfortunately rooted in your political opinions. If you look at Vermont, still does not have cases of the variant. Vermont has one of the most highly immunized states in the United States, and they've done a very good job. And unfortunate, I mean, it should not be. I don't know why any disease should be political. The virus doesn't care whether you are Republican, Democrat, Independent, whatever you are, a libertarian. It's going to infect you. And so I think unfortunately we know that the red states and the red counties and blue states have a much higher prevalence of infection, death, hospitalization, all of those things, which is really happening. So to answer your question, work with your friends, work with your healthcare provider, work with your community. I think we need to get the key opinion leaders in the minority communities to speak up, and some of them are, but this is an ongoing thing. This is, this mistrust of the healthcare system did not develop in the last 2 years or last 20 years. It has developed over the last 400 years. We really mistreated our minorities when it came to healthcare and abused them and misused them. So how can I tell if I have the Omicron variant? Do labs report that? Labs do not, the standard testing will not report that. The virus is often has to be determined if it's Omicron or not by some state labs and the CDC, some research labs and some other labs like Quest and LabCorp. I think they can do it, but they don't routinely report that. I think you should assume right now that if you are getting the virus, it's more than likely it's Omicron, because that's what is prevailing, at least in other than 8 states, and many other states been identified. In other states, it's probably the predominant. And it's the doubling time for infection is about 3 days for this virus. So it's going to spread in terms of community prevalence, as opposed, I think it was 2 weeks for Delta. Don't quote me on that. I think that's what it was. We have another question. Who is most at risk of contracting the variant? Are people of certain ages at more risk? So anybody can get the vaccine infection. As I said, the virus doesn't know if you are at high risk or not. They're just looking for a host that can infect. So the people who are at risk, they are immunized. They are first group of people who are more at risk for the infection. Doesn't mean that if you're immunized, you can't get it. So if you're immunized and boosted, you are less likely to get it. You still get infected. I guess your question may be who's more at risk for not necessarily contracting the variant, but at risk for morbidity or hospitalization, serious illness. That's right now we know those individuals who have underlying health condition, the elderly. They are the ones who can, because of their comorbidities, can be at an increased risk for serious morbidity and mortality with any coronavirus, even with Omicron. We know in the South African experience, the Omicron stayed and kept the immunocompromised infected for a long time. So so you can be sick with it for a while. You may not be seriously ill, but you can be sick for a longer period of time if the virus continues to replicate in your system. So I think I've answered most of the questions, unless you have some questions on Facebook, which I cannot see.
No, we don't have any questions on Facebook right now, but Ali, any other questions?
No, we're good.
Okay. Well, thank you very much, Mobeen bhai. As always, you leave us with a wealth of information, and I hope all of us follow the basic, guidelines and protect ourselves and our family and our communities. Thank you very much, and have a wonderful day.
Thank you. Assalamu alaikum.
Wa alaikum salam. Thank you.